So I'm Tony Riley. I currently work as one of the clinical team managers, but I also still retain some work as a cognitive behavioural therapist. I was on the interview panel for our first peer support worker, which was completely new. We didn't have peer support workers before that. And at the time, to be honest, I wasn't sure what to expect myself. And I'm pretty confident to say that the peer support work is invaluable. We have 2 peer support workers now in the central early intervention team, Jason and Terry. There's another peer support worker, Craig, in the Yarmouth team, and hopefully soon there'll be a peer support worker in the West early intervention team. I think really what it's about is they just bring a different perspective. I feel that with our clinical work it's really important that we have a sort of degree of humility, if you like, that we know that we're sometimes for medication we've reached the sort of limits about how the degree that medication is going to be helpful. Equally with some of our talking therapies and psychotherapies, there could be limitations or they don't suit certain people. So having that lived experience perspective adds, if you will, it adds to the components that we have and what we can offer people. And very importantly, I think it does have an impact on the staff's perspective. Having that lived experience constantly as part of the conversation. Peer support workers in our team will often join clinical case managers in their working with patients. I would say that they're pivotal part of those conversations. I think often the impact of psychosis can be demoralisation. It can impact on people's hope and people's view of the future. So just the fact that they can meet with someone as part of our team who is not only talking about recovery, is not only talking about hope in a kind of theoretical way, they're actually demonstrating, they're modelling that this is possible, recovery is possible, and that they can instill hope through using their direct experience. I mean, as other clinicians in the team, we can talk about recovery, we can talk about what we know theoretically, and also we can talk about what we've observed. But I think just having someone who can have a very direct conversation based on their lived experience to instill hope and demonstrate that recovery is possible. Yes, I mean, I've had feedback myself from users of our service who said that they really value having those sort of conversations with our peer support workers, Jason and Terry, for that very reason, because it's a different type of conversation. Try as we might, those of us in the team from clinical backgrounds, it can be very difficult to step outside of our sort of clinical role, our clinical conversation. And it's just a different tone, I think. It's a different tone of conversation. And I certainly had feedback from users of our service who said that kind of conversation has been really important in terms of their recovery.